Losing a natural tooth immediately disrupts your daily life. It changes the mechanics of how you chew your food, alters the way your jaw functions, and often takes a heavy toll on your structural confidence when you speak or smile. When you look for a way to fill that gap, modern dentistry typically presents two primary choices: the dental bridge and the dental implant. While both of these procedures successfully restore the visible part of your smile, they operate on separate medical timelines. Dental clinics frequently market implants as the ultimate permanent fix. Clinical studies back this up, showing that implant survival rates routinely extend well past 25 years. But patients immediately run into a serious point of friction. Securing that decades-long longevity requires a massive upfront financial commitment, often significantly higher than the price of a traditional bridge. Today, we are stripping away the marketing language. We need to evaluate whether the biological benefits and the long-term return on investment of an implant actually justify that severe initial price tag, because the choice you make in the dental chair today will dictate your biological health and your recurring financial obligations for decades to come. We can evaluate solutions using this quadrant chart, measuring a procedure's lifespan against upfront cost. The traditional bridge sits in the lower left, presenting a lower financial barrier but a shorter lifespan. The dental implant occupies the upper right, offering maximum durability but requiring high initial capital. This leaves you with a difficult dilemma. Should you part with significantly more cash today, or is the cheaper bridge a mathematically safer bet? Answering that requires looking past the immediate sticker price. We have to analyze the true multi-decade timeline of both procedures. A traditional dental bridge is highly reliable. With proper care, it delivers a predictable aesthetic lifespan of 10 to 15 years. But it comes with a strict medical trade-off. A bridge only replaces the visible crown. Eventually, normal daily wear and tear or subtle shifts in the supporting teeth will cause it to fail, requiring a full replacement. A dental implant takes a different mechanical approach. Instead of a surface-level cosmetic patch, the hardware acts as an artificial tooth root. Biocompatible titanium is uniquely capable of physically fusing itself directly into the organic structure of the human jawbone. This root-mimicking fusion actively halts the structural bone loss and facial sagging that naturally begins the moment you lose a tooth. A bridge cannot do this. It leaves the underlying socket empty, leaving the bone susceptible to steady degradation as the years pass. While a bridge successfully masks the visual symptom of a missing tooth, an implant medically replaces the lost biological structure, securing the integrity of your jaw. To see the financial reality, let's look at this comparison table, tracking initial cost, lifespan, and replacements. The bridge demands lower initial capital, but locks you into a guaranteed 15-year replacement cycle. The implant requires upfront capital, but delivers a 25-year survival rate. We can project those differing lifespans onto this 30-year cumulative cost chart to reveal a patient's total lifetime expenditure. We establish the bridge's baseline cost here, reflecting its lower upfront price. At year 15, the bridge fails and requires replacement, driving the cumulative cost straight up. It hits that exact same vertical spike again at year 30. The implant begins significantly higher on our starting axis due to the surgical fees. But thanks to its extreme longevity, that line stays flat. No recurring capital is required over the following decades. Notice this crossover point. This is the exact moment where the recurring costs of replacing the bridge exceed the single upfront cost of the implant. This intersection mathematically proves that the initial sticker shock of an implant is actually just a method of prepaying your future dental bills at today's prices. For any patient with a life expectancy extending beyond 15 years, the implant ceases to be a luxury expense. It becomes the most mathematically cost-effective choice. Of course, a multi-decade return on investment matters little if you cannot actually afford the initial procedure today. To make a practical choice, we can use this decision tree flowchart, starting by identifying your primary constraint. If your primary limitation is immediate available capital, your path leads directly to the dental bridge.
For the budget-constrained patient, a bridge remains a perfectly functional, time-tested solution. You simply have to accept that you are deferring eventual replacement costs to your future self. If you possess the capital today and your priority is long-term value, your path leads to the dental implant. The active biological preservation of your jawbone and eliminating a 15-year replacement cycle makes the implant the definitive medical choice for long-term optimizers. Assess your current budget, consult with your clinician, and choose the timeline strategy that fits your current stage of life. Choosing a tooth replacement strategy requires aligning biological reality with your personal financial capability.